Hello everyone. Today we will discuss about symptomatology of breathlessness. So, breathlessness is one of the commonest symptom with which many patients of respiratory and cardiac diseases will present to us. So, when this is the complaint, how we should analyze it? Here the thing is, we have to understand that if the case is fitting into CVS, so we will grade it according to NYHA, New York Heart Association grading system we will follow. And if it looks like respiratory system case, we will grade according to Modified Medical Research Council system of grading. So first thing is we have to know what is the description of these things. So here when we discuss about NYHA, I want to tell you that first we should understand a difference between activities of daily living versus day-to-day activities. So this is very important. So day-to-day activities in the sense the ones which everyone will be doing, for example brushing, bathing, eating food. So all these are considered as day-to-day activities. Whereas activities of daily living in the sense a person who will be doing the routine job. For example, if the person is a medical student, so for a medical student, activities of daily living will be like attending clinical postings, classes, reading, time spending in sports, all those things. Whereas if we compare this activities of daily living with a labor, coolie workers, etc., they will be doing high intensity works as their daily living activities. So this is the difference. If we just observe them and if we compare, a medical student will be doing mild to moderate intensity activities only. So that will be the activities of daily living for that student. Whereas for a labor, high intensity activities are the activities of daily living. So this point we will take into consideration when we are describing about NYHA. So that we will see now. So NYHA is graded according to 4 grades. Grade 1, 2, 3, 4. So grade 1 is no symptoms. That is, when it comes to symptoms, here we can remember NYHA will involve symptoms of PDF, P, D and F. That is, we will consider palpitations, dyspnea and fatigue. So if an individual who is having heart disease, but when he or she is doing their activities of daily living without any symptoms of palpitation, dyspnea or fatigue, we will grade them as NYHA class 1. Suppose there is mild limitation to their activities of daily living. Limitation might be in the form of palpitations, dyspnea or fatigue. This is considered as NYHA class 2. If there is moderate to severe limitation, we will call it as NYHA class 3. And suppose these symptoms are restricting the individual from doing his or her activities of daily living at rest itself, that is called as grade 4. So this is the thing. So why we are focusing on these symptoms is because here one of the cardinal symptom of cardiovascular diseases, that is chest pain, is not included in case of NYHA grading. And one more thing is, this grading is very much subjective. For example, for one individual it might appear as mild limitation, but for others it might appear as moderate to severe limitation. So this is a subjective grading we can consider. When it comes to mMRC, that is respiratory system breathlessness grading. Here we will grade them in 5 grades actually. So what are those 5 grades? Grade 0, 1, 2, 3 and 4. 0 is no breathlessness in a case of respiratory system disease, whereas grade 1 is what? Person will get breathlessness on walking uphill. So this is the thing, walking uphill. Grade 2 is if the person is getting breathlessness on walking on a level ground with an individual of same age, same gender. So this person will get breathlessness, but the other one will be able to walk without any breathlessness. So this is like comparison of two individuals, two persons walking on plain ground. Coming to grade 3, it is considered as mMRC grade 3 if the person gets dyspnea on walking for about 100 meters. So 100 meters in the sense, whatever the day-to-day activities which the individuals will do in their home, for example using washrooms and all, that can also lead to breathlessness for the individual. Then we will consider it as grade 3. So what is grade 4? 4 is breathlessness at rest, just like NYHA. So how to remember this? We should observe the explanations carefully, then we will get to know. For example, grade 0 is no. So we can compare these two. Grade 1 is uphill. So this looks like letter 1. Grade 2 is 2 persons, comparing 2 persons walking on a plain ground. So grade 3 is 100 meters. So 100 number has 3 digits. So that is grade 3. Grade 4 is at rest. Again, this word REST has 4 letters. This is how we can compare the things. Overall, the point is, whenever we are discussing about breathlessness, if it is in CVS, we have to know that it is based on the activities of daily living. And the symptoms which we consider are PDF. Chest pain is not included and it is very much subjective. In mMRC, we have to remember the grades according to this easy mnemonic. Hope you got the point. If you are able to understand these videos, please consider sharing among your friends, and also please subscribe to the channel so that we can come up with such easy and informative videos for you guys. See you in next video. Thank you so much.